I'm Dr. Kewal Krishan. I'm Director for Heart Transplant and Ventricular Assist Device Program at Max Hospital, Saket. Today I'm going to tell you 5 important things which everyone should know about the heart failure. Heart failure is when your heart is not able to pump enough blood according to the requirement of the body. And the warning signs, if the patient develops heart failure, the most common signs are your facial swelling, your abdominal swelling, your pedal edema, and your breathlessness due to collection of fluid in the lungs. So these are, or you wake up in the night suddenly because you cannot breathe properly. And because the heart failure is a progressive disease, so it keeps from acute heart failure to chronic heart failure, it keeps on increasing. When the heart size keeps on increasing, at some point it becomes irreversible. And you keep on coming in and out of the hospital again and again. And these kind of patients are called frequent flyers. Frequent flyer means every 3 months they come to the hospital, they get treated, and then they get better, and then they go home. So with this, there's a lot of financial burden on the society also, that the person cannot work properly, and the patient who is affected, and the other 2-3 family members are also engaged with him. They also cannot go to their job. So 3 or 4 people are get engaged in one disease, and this reduces not only the working capacity of the family, but also it's a financial burden on the hospital also. So to make the things better, or to make the disease better, for the function of the good function of the heart, you need to go for definitive treatment. Once you have definitive treatment, the affected patient is also going to go for work, and the other family member also will be working properly. So the definitive treatment for end-stage heart failure or ventricular assist devices, which were not there 5-6 years ago in this country, but nowadays a lot of people are getting, and it increases it's not only improving the quality of life, but also the survival of the patients. You know, the corona is a pandemic, and it has affected almost everyone or the whole society. So due to COVID-19, the lungs are affected. Those patients, those who had underlying disease, mild or moderate disease, it has become severe, and it has got precipitated because of the COVID lungs. Because everyone, even if you are not symptomatic, you didn't go to the hospital for that, but still your lungs got screwed up in some or other ways, maybe 10%, 20% or 40%. Those patients, those who have underlying disease, because of the lung failure or getting compromise of the lungs, or development of thrombi, because COVID patient, they have more chances of developing clots, blood clots, and that lead to right heart failure. That's pulmonary embolism. All these kind of patients, whether it's because of the lung failure or because of the formation of clots, they have precipitated the underlying heart disease, and now many patients are coming up with heart disease, those who were healthy otherwise before COVID-19. The common thing which you can do at home is do exercise to keep your heart healthy, to avoid junk food, to avoid this white poisons. White poisons, I mean the salt and the sugar, because diabetes and hypertension again lead to secondary failure of the heart. And still, if your patient has a end-stage heart failure and your doctor says there's no treatment, so then you can come to us. We will help your patient to get better and make his life way better than what he was living.